Good afternoon and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice located in Encino, California. And this is KMET 1490 AM ABC Radio Live. And I'm here with my best friend, business partner, and colleague of many years. I'm not going to say how many years. Let's leave that up to him, Dr. Robert Jaffe, who's also a licensed marriage and family therapist and a certified hypnotherapist, offering you a program on human sexuality.
What a great introduction. Thank you.
Thank you.
So we are here today. We're going to be talking about some interesting things, the title of which is The Guide to Sex After 60.
Yes, everybody focuses on young people.
Everybody focuses on young people.
Teen sex, young adulthood sex, middle-aged sex, adulthood sex, and then it stops there. Well, I have a good news.
It doesn't stop.
Not only doesn't stop there, but it also gets better, right? So I would like to invite you to please call us at 951-922-3532, and definitely we want to hear from you. This is your program, so your experiences, your stories are what we're looking for, because this is how we can interact and this is how we can make this program more effective and better for you.
Absolutely. Welcome to our program, and please feel free to call us. What's our number here?
951-922-3532.
951-922-3532. We're hoping somebody's listening. And
Sean is listening.
And Sean is listening. And who's ever listening out there, we would really like to know that you're there and that you're listening, and give us some feedback. We'd appreciate it.
Yes, and Sean, we can engage you in a conversation if you wish. We're happy to have you as our guest today.
Mm-hmm.
So let us know how you feel about that.
Okay, sure, depending on what the topic is.
Guide to sex after 60.
He's too young for that.
He's too young for that, yes. So, yes, human sexuality. Human sexuality begins at birth and it ends when we die.
Indeed.
This is something that there are a group of people who are aware of that, and there are a group of people who don't think that way. They believe that once a person hits like 50, for example, for women, menopause, and for men, after they have kids and grandkids and their testosterone level kind of drops or their PSA kind of increases, they think that's it.
Right, yeah. Men don't get erections and women don't get lubricated.
They think.
Right? So sex after 60 never happens. Not true.
Not true.
Can actually be a lot better. A couple of the reasons that it can be better are, number one, pregnancy is no longer an issue. Number two, hopefully you have more experience. And if you have more experience, you can help your partner and help yourself to enjoy it more. So those are a couple of the reasons why it can actually get better. And our sex drive, like you said, it lasts throughout our lives. So we have to combat the myth that older people don't enjoy sex, don't want sex, or don't look forward to sex. It's an illusion.
Exactly.
Not true.
No, not true. I mean, there are many reasons that why an older age couple, 60 and up, can have far more enjoyable sex than we believe. That that they're done with their sex life, right? So first of all, they have a much deeper intimacy with their partners.
Right.
And you and I have been writing about intimacy, and we see that how intimacy plays a major role, in sexual relationship between couples, and and then how intimacy keeps a relationship going, right, in a healthy way, right?
And I'm going to say that a euphemism for intimacy is in, to, me, see, or see into me. And so when you're thinking of intimacy, you're thinking of wanting someone to see into you, to your deepest level, to your soul, the other person wanting the same from you to see into them, and to recognize their worth. And our worth as a human being is incredibly rich, and we know that when we are able to be intimate with another person. We feel our own value, we feel our own importance, and that is a very, very powerful experience to know that about yourself.
Yes, exactly. So aside from, experiencing a much deeper intimacy with partners, there are also fewer distractions,
Mm-hmm.
right? Such as, attending to work like a young person, right?
Mm-hmm.
Having children around,
Mm-hmm.
right? Worrying so much about finance. I mean, some may, but there's still, they are
Well, these are generalizations.
generalizations,
Yeah.
right?
Yeah.
But generally, people who are 60 and up, per statistic, we know, and I don't know what that number is, but we know that they have less distractions. And then they have more availability to continue with, maintaining that intimacy and, have enjoyable sex as a result of that.
Mm-hmm.
And like you said, they don't have to become concerned about pregnancy.
Right.
Right. So that's a huge deal, right?
Right.
And then they just have, more time for themselves, and they also know more about themselves and their bodies, and they're done with watching TV so much, or watching or they have other programs that takes time away from them. So basically, we are concluding here that being together is more priority than being engaged with activities that is solo.
Right.
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 So that's how that intimacy becomes stronger between the two of them.
Mm-hmm. Absolutely.
Right.
Yeah, and being together um, in an intimate togetherness is very, very alluring.
Yes.
It's very attractive, and it's very alluring. And people who have been together for long periods of time and have worked on their relationship and have created that intimacy can definitely enjoy it in a sexual way.
Yes,
Mm-hmm.
absolutely. There are, having said that, there are factors that happens as a result of aging, right? That may or may not impact, a group of people who are above age 60,
Mm-hmm.
right? For the most part, it may, but then again, they are, thanks to technology and medicine and all the informations that they are out there, they are ways to overcome those physical, changes and at some point limitations,
Mm-hmm.
right? For example, hormonal changes. It happens both to men and women, right? It starts actually hormonal changes. It starts at on and about age 45,
Mm-hmm.
right? And of course, all these ages, they have plus minus to it, right?
Right.
So it's not a set date like that. The onset of age 45 is not that, hormones are just going to drop. No. So new issues can, temporarily, show up in life. Sex hormones, can kind of change. For women, menopause brings, a drop or a change in the level of estrogen, and then vaginal walls can start to get thinner and more drier, right? And then men can see, their testosterone level and estrogen level kind of become, changing from their where they need to be. So then this can make it difficult for men to have an erection, and then as they had it, for example, when they were 25 years old, right? So maybe it takes longer, maybe, it becomes more challenging, but it happens, right? And then, so the other factor is that, there are changes in brain, and the blood flow also kind of impacts the functioning of sexual organ, right?
Yeah.
So how do people overcome these hormonal changes, right? Obviously, for women to consult with their, gynecologists, and for men to consult their urologists, there are ways to, first of all, test the level of hormones, and then determine based on those changes. There are several options that women and men can have to overcome, the impacts of those changes on their sexuality. And that's why I'm saying, thanks to technology, the medicine, and all the informations that they are out there. And today we see that, there are men and couples that, they start having their pregnancy at a much older age, like above 45 years old, right? So we know that things can happen, things are doable, and these changes are not sufficient enough reasons for people not to have an enjoyable, intimate sexual life together.
Right.
Right? It's just hormonal change. It's just part of the, aging process, right? At some point we have a peak time to it, and then after that peak time it will go down, right? But it doesn't mean that our intimacy too needs to go down, right?
Well, peak in terms of not in terms of interest necessarily,
right,
but peak in terms of our body's ability to generate the everything that's needed in order for our sexuality to be at its highest level.
Yes,
That's what we mean.
right, exactly. And so I'm going to get to this maybe later on, but I just want to make a point here that not every sexual positioning and sexual experiences need to be like what we see in the movies when we are 60 and over, right?
Well, they don't often show people 60
right.
and over
60
having
and
sex.
Having sex,
Right.
So then, and maybe we should have a program on that to talk about how the people who are at the higher age level.
You mean make a movie?
Make a movie. I'm sure there are actually plenty of movies out there. I have seen some of them.
Okay.
And they are actually very educational, and I think there are many links online that we can find, and people can see them and see how sex actually is done between two older couples.
Okay.
Right.
Okay.
So we're going to get more into some of the details, not the movie making, and then right after our commercial break. How's that?
Stay with us, and we will be right back.
Okay. Welcome back from our commercial. This is Heart-to-Heart program at KMET 1490 AM ABC News Radio. Dr. Mitra and Dr. Robert here, offering you a program on human sexuality. And our topic today is Guide to Sex After Age 60, right? Such a fascinating topic, because most people think, oh, well, I'm done, right? After 50, I'm done at the most, right?
Until they get there.
Until they get and they say,
go, oh no, I'm turning 50. I'm turning 60. Well,
right.
Guess what? You're still you.
You're still you, exactly. So please call us, because we want to hear from you and your experiences. Our number here live is 951-922-3532. Also, please introduce this program to those that you believe that they can benefit from this program. I'm kind of stumbling on my words. I don't know why. But anyway, here we are. So continuing with the rest of the program. So we talked about, how it's a myth that, people after age 60 are not able to have sex, or they don't feel like sexual together. And we made a reference to intimacy so far, and then hormonal changes. So for women, we know that changing their genital area is one of the prime concern, right, for them. The main sexual problems for women tend to be trouble getting the orgasm, or experience you're having, lack of desire, or they have vaginal dryness, right?
Yes.
In some women, their vaginal, kind of shortens, and then it narrows with age, right? And then lubrication naturally may not happen, and then this can cause pain when they are having sex. So there are many ways of taking care of that, so such as variety of water-based lubrication that they are there, the gels, and then there are vaginal moisturizers that they can be used, and also doctors can prescribe what is known as vaginal estrogen, that it can come in a form of a cream, or different forms of that they can insert themselves, right?
Mm-hmm.
And then, so we cannot stop the aging process, right? We cannot stop the change in the shape or anything that our body goes through. However, we can provide ourselves with the services, with the methods that they are available to overcome what is possible to overcome. Mm-hmm. Right? Mm-hmm. So if nature takes away the natural lubrication of the female genital area, well, science has given that back to us, right?
Right. Yeah. Science, better living through modern chemistry.
Exactly.
Yes.
Yes. And for those who still would like to use condom, and that is actually by far, is recommended, because just because a female is not able to get pregnant at the age 60, it doesn't mean that they cannot get sexual transmitted infection. So it's always best to use condom if you have a partner that you haven't had a long-term relationship with, and you're not sure about their sexual backgrounds in terms of their activities. So it's always best to use a condom, and there are many lubricated ones there as well. Mm-hmm. Right? Absolutely. So then, there you go. Again, lubrication is there. So these are the really easy problem to overcome, right?
Yep.
And then doctors, by providing that estrogen, that's also the other ways that, are very much helpful. And I know of a few women, excluding my clients, who are using these services, and they are very much happy with their sex life. Mm-hmm. So the next one is, erectile.
You didn't mention. Oh, go ahead.
No, go ahead.
No, you were actually going to say it. You were going to talk about erectile dysfunction.
Yes.
Yes.
Right. So next to women, we have men going through the process of, what is known as erectile dysfunction, right? Actually, I'm not really, comfortable with the use of, dysfunction, because process of aging doesn't mean that a person has a dysfunction.
Correct.
Am I correct?
Correct.
Right?
Yeah. Yeah, dysfunction really is kind of pejorative,
right?
Meaning it's a judgment,
right?
As though if you can't get or maintain a strong erection, it has to do with dysfunction rather than a natural part of aging. And most men at some point don't have a strong erection or don't get an erection, and it can be many factors for that. So, but like you say, well, like I was saying before, better living through modern chemistry. Of course, now we have erection medications.
Yes.
Viagra is one of them, and
of course, they need to be taken under the advice of a physician, family physician, or
yeah,
a urologist.
right. But oftentimes the erection is the symptom.
Right.
Yeah. So if the erection is the problem, well, we have a medication for it. But if it's a symptom of a problem, then even if we take an erection medication and men are able to get the erection, it of course doesn't really solve the problem, because whatever the problem is going to manifest in another way.
Exactly.
And if the problem is an emotional problem, and they don't attend to that, and they just try to deal with it by taking the pill, they can get away with it for a short period of time, and then it's going to catch up with them.
Exactly. So we want to know the underlying causes of what is seen to be as erectile dysfunction, which is not a dysfunction. It is a natural process of aging. So that's not a dysfunction.
If
right?
it's that, it's not a dysfunction.
It's not. Yeah.
If on the other hand there's some physiological problem,
well, yeah, that's a different story.
And also even a psychological, a psychological problem, then we can say dysfunction because it doesn't have to be there and it's fixable.
Right.
Yeah, so that's what we mean when we say dysfunction. It means it's not functioning as you would like it to function, and there's a reason for it. And if you discover what the reason is, very frequently there's treatment for it.
Right. So a couple of those problems that can cause, I mean, I'm not suggesting that it does, but, according to research, we see that there are two conditions that can cause erectile dysfunction among men above age 60. One is, diabetic type 2, right?
Right.
So, it causes poor, blood sugar control. It just over time, it can, if it goes untreated and if it goes unnoticed, it can damage the nerves and blood vessels that supplies, sex organs.
Diabetes.
Yes. Right. And then there are certain medications, that can help with that, and also sometimes implants can help with that. But these are really the implants are we're looking at severe cases, right? That the diabetic needs to be very much in a really later stages for a man to feel that way, and usually 60 is really still young to do that. But still, if that is experienced, then it's best to consult your physicians. And then for women with this condition, they can have less feeling in their genitals, right? And then they can have the experience of more genital, infections. They can feel more irritation in the area, which that the irritation may give them an unpleasant experience during, sexual activity, right? However, the good news is that these are easily treated. Right. So consulting your physicians and following the direction that they are suggesting can easily take care of these issues. I mean, there are things that realistically we don't have control over it. I mean, aging is not something that we can control. However, with nutrition, with exercise, we can, take in the right supplements, we can kind of slow down the process of aging, right? And also consulting our physicians and being on top of, other factors that may cause, sexual difficulties, then we can help ourselves. The other condition that may cause, erectile dysfunction is, is heart disease, right? A heart attack, can cause, some problem. Heart disease, especially when arteries are getting narrow and they become kind of harder than usual. And then when blood doesn't flow as easily as it used to be, it as it impacts any other part of body, it also impacts, the function of genital areas, and also, it impacts reaching orgasm. It makes it harder, and it may take longer to do that, right? So, but once the heart condition is is under control, when the right medications are taken, then the doctors supposedly can give the individual green light to have sex. But then again, there are the points that a person with a heart disease needs to be mindful of, like if they're having, chest pain during having sex, or if they have problem breathing, and also, other symptoms that they are indications of something may not be right. So the physicians are the best person to suggest what they are for each person, because everybody's different and not all the symptoms are applicable to everybody, right? But we want to be mindful of our bodily responses, because they are saying something about us. They are saying whether the sex that two people are having at the age 60 and up, is it really pleasurable without any complications, or they are pleasurable with complications, or they are just plain complicated.
I want to say something also about heart. The heart is obviously it's the thing that keeps our body running, right? It's the motor that keeps our body running. And when people do have heart problems, they often become fearful of stressing themselves. And of course, when you're having sex, your body is stressed.
Right.
It's very stressed. I had mentioned before that there's two kinds of stress. There's distress, which we know is a negative feeling, a negative expectation of something happening. And then there's eustress, which is a positive stressor. And so your body is stressed when you're having sex, but it's a eustress. But people who have had heart problems often get confused about it and become afraid then that they're going to be stressing their body in a negative way, and that psychologically that will keep their penis from erecting.
Exactly.
And that happens quite frequently after there's been something that's happened with the heart.
Right.
And of course those things can be dealt with psychologically.
Exactly. And then so there are other challenges, other medical conditions that can affect people who are above age 60. They can impact their sex life, including weight gain, arthritis, chronic pain, bladder control problem, dementia, high blood pressure, cholesterol, and side effects from medications, depression, and stroke. Also, surgery that has happened, especially in sexual area, can impact self-image and whether they like the changes that have been done or not. Women with prior C-sections or other form of surgery on their abdomen, they may not like what they see when they at a later age, because scars may kind of thicken and then show themselves in a different ways, or stretch marks, and the extra skin as a result of weight loss and weight gain and all of that. So there are changes that they are out of a person's control, right? But when there is intimacy and self-acceptance and acceptance of others and looking for love, those are not going to be the prime concern of connection with somebody, right?
Say that again, not quite.
When they are that youthness, that beauty of the youthness, when it's gone,
yes,
right? So two people may not like what they see on their body, like a female, right?
Yeah.
May not like the stretch marks that left after pregnancy.
Right.
Right. We know that we cannot get rid of a stretch mark, right? If a female has lost quite a bit of a weight, right? unless they go and have a, tummy tuck, right?
Mhm.
Their stomach is not going to be as flat as when they were 25 and before pregnancy,
Yeah.
right?
Yes.
So they may not like their body as it ends up to be at the age 60,
Uh-huh.
right? And then, their partner as well. I'm sure that, as women age and they go through the change of physical part of them, a man also goes through similar changes.
Mm-hmm.
So they may not like their bodies as much as they liked and appreciate their body when they were much younger, right?
Mm-hmm.
But for two people at the age of 60 and up, they're looking more of a spiritual connection, and their physical part may not be as much as an issue as if they were much younger. That's what
You're
I'm
talking
saying.
about in a committed
In a
relationship
committed relationship.
where the people maybe have been together for a long period of time.
And or they are meeting online. I mean, these
Right.
days there are many couples that they meet online, and they have a new relationship much later in life. So their expectations of having meeting somebody who's 60 but having a body of 50 is kind of unrealistic. So they already know that.
Mm-hmm.
I
Right.
think, right?
Well, some people know it, and some people are shocked by it.
Are shocked by it. Yes.
Yeah.
So let's talk about these shocks right after our commercial break.
Okay. See you soon.
See you soon.
PM.
Welcome back to our commercial break. Dr. Mitra and Dr. Robert here at Heart-to-Heart program, talking about how to have sex after the age 60 and what are some of the complications of that. We would like to hear from you. Please call us 951-922-3532. And as here, my voice is echoing. I don't know why.
Echo, echo, echo.
So I hope that's not distracting to you. And we were talking, Dr. Jaffe and I, we were talking about the beauty part of body image issues after the age 60, and how that may play a role in sexual relationship of two people who are at that age category. And my conversation was that uh, they are a group of people who all their lives they have been athletic, and they have been in good shape, and they continue to be in a good shape, relatively speaking, for age 60 and up, and they continue that way for as long as their body permits them. We see some of those people among actor and actresses, people who are models and people who are really famous, and and they have focused on their body because they just could do that, and they continue that way. They are a group of people that, on the other hand, the opposite, they seldom focus on their shape, and then obviously at the age 60 and up, they may not have the shape that's desirable. But then again, those group of people, both men and women or any partners together, they're okay with that. I actually know of a few couples that way, that they are heavily overweight. I'm talking about 300 and up, but they are having good relationships together. And then they are a group in between that, on average, relatively speaking, depending on their medical conditions and life status and life choices, they are either on average in a good condition, and they usually end up with a similar partner. So however we take care of ourselves at a younger age, it does manifest itself in our older age. And then again, there are also a group of us among the average people that at some point in a later age we decide, what, I want to take care of myself, and that we get busy with that part, and it either works or it doesn't work. But usually taking care of ourselves for the most part works for the best, and that also impacts our sexual relationship, right?
Absolutely true.
right?
Mm-hmm.
Okay. And then they are a group of male and female. It doesn't matter. Both they have, expectations, and so everybody goes after their expectations. And we talked about, online dating, which I have seen a few commercials for older age, online dating, and it's really, interesting. The two examples that they have, the actor and actresses that they talk about how they went on these systems and they find dates, they were actually, not in a very good shape,
Mm-hmm.
but they were happy about finding, their soulmate, online, and how they were happy, and that's how they invite people to join these programs and online dating for 50 and up or 60 and up. And so we see that even in commercials, there is a message that, this group of people, is best to be realistic about what they want, because, that age group doesn't call for fit body that we used to have when we were 20, 25, 30, or even 40. So the same way that we go through the challenges of medical condition, we go through the challenges of how we look. And to me, based on my experiences with, with my clients, that I have to say that when I have a couple that they are, on the older side of the age, they are 50 and up or 60 and up, they are looking for permanency in their life. They're looking for life partner. They're looking for safety and security, and of course, sex. So it's not like, when we are at 20 or 30 or 40, when sex is primary. So sex at the older age has different meanings attached to it.
Correct. Absolutely.
Right.
Yeah. And I think everybody has their own value system.
Yes.
So some people value the body more than others.
Right.
And some people value intelligence more. Some people value emotionality more.
Mm-hmm.
Some people value spirituality more.
Exactly.
We all have our own hierarchy, and so whatever we value, that's what we're going to, I think, seek in the other person as well.
Exactly. Yes, and that, that's why, when we find that partner that is desirable in every possible way that we will hope to find that partner,
Mhm.
that's, that's the relationship that most people stay with, right?
Yeah.
It's a combination of everything that a person is looking for.
Mm-hmm.
So these medical conditions that we talked about, we know that there are a variety of solutions for them, and including constant consultation with physicians,
Mm-hmm.
right? And then when it comes to sexuality, though, it may not be easy for a group of people to talk openly about their sexuality with their doctors,
Mm-hmm.
right? And then and if the doctor also doesn't talk about it, makes it even more difficult to communicate about this,
which
right?
we now know, especially your research was focused on that a lot,
Right.
as far as doctors' difficulties with discussing sexuality with their patients.
Right.
Patients being embarrassed to bring it up, and so the sexual issues never get addressed, and if they're not addressed, they never get resolved.
Yes, the two areas that, people's sexuality becomes a concern is when it is about, pregnancy,
Mm-hmm.
and then when there is obvious and known sexual transmitted infections.
Mm-hmm.
Right. Other than that, usually there is not a talk. So one of the things that I do myself here, I like to point it out, and also in my therapy sessions, I encourage, in particular, women, that if they have a sexual concern and then their physician doesn't bring it up, for them to actually go and ask about it. And you can say something like that, can you recommend a sex therapist? Or do you think that this sexual problem is covered by insurance? Do any of my medication may cause any problem on my sex activities? or can you help me with evaluation of my estrogen level, or is there an alternative to erectile dysfunction medication, right? So when patients themselves become proactive about their sexual need and ask about it, physicians have no other alternatives but to provide the information. And then if they don't have the information, they are, obligated to provide adequate referrals.
Yeah, and I think that because of sexuality as being such a taboo. Taboo topic, that often physicians may give the impression to the patient that what they're asking is not that important.
Yes.
And so I think it's important for us to say that if you have a question, it is important. And if your physician tries to tell you that not to worry about it, or it'll go away by itself, to not stop there, to do your own research, and and if the physician can't make a referral, to do your own search and find someone who can help you.
Exactly. I mean, I want to make a comparison here between how we go for our checkups. Usually, an average person once a year they go for eye checkup.
Mm-hmm.
They go for every 6 months. We go for dental checkup, right? We go for our heart checkup, and pretty much, once in a while we do an ultrasound for abdominal checkups, right? We take an X-ray of our chest to make sure our lungs are doing fine. So we pay attention to just about every part of our body.
Mm-hmm.
Many people, especially women, pay so much attention to their cosmetics and skincare and hair care and all of that. It's just so questionable that when it comes to genital area, that part is so ignored, globally, I will say. And unless there is a major issue going on, that's when people go after care for their genital area.
Right.
It is more so in women. It is as though if I don't see it, there is no problem. Mm-hmm. Right? So especially when we get to the older age and we kind of believe that that department is done, I'm done with my sexuality, then we actually pay far less attention to our genital areas, and then the care that's required in that section of body. Mm-hmm. Right. Mm-hmm. So we see that how culture myths that they are running the society about sexuality can actually impact our healthcare, sexual healthcare in that sense. Mm-hmm. Right?
Correct. Absolutely. Yeah. And it's the reason I brought it up about that if the doctors dismiss it is because patients often come in with embarrassment or shame,
right,
related to their sexuality or their sexual functioning. And if the doctor doesn't take it seriously, it's very easy for the patient to dismiss it. And of course, then the problem just continues.
Exactly. Here, I like to point out to an example that recently brought, I experienced that, and I would like to share it here. That's when not having the adequate information, not having the right information about aging and how sex can be impacted during aging can actually create many of relationship problems. Mm-hmm. I received a call from a gentleman that he was concerned. He was about 70, and he had a concern about his wife, who was about 68. And he was saying that his wife is no longer feeling sexual towards him. And he was really concerned that, what happened. And then he said to me that he heard it on a program that if a female says, I don't feel like a man touching me anymore, then she could be a lesbian. And then he suddenly said, oh my God, what happened? Have I been living with a lesbian? How is my wife turned into become a lesbian? And then I think she's a lesbian. So he, as he was talking, he kind of summarized for himself and concluded that if she's not sexual anymore, then that means, she must be a lesbian. Where in fact we know that the aging process the poor woman may have gone through all these steps that we just talked about without any form of treatment.
Yeah,
right?
and that reminds me of Einstein's famous quote.
Right.
Einstein's famous quote. You know that quote, right?
Which one? There are so many.
There's only. Einstein said there's only two things that I know of that are infinite.
Yes.
He said the universe and man's stupidity, and I'm not sure about the universe.
The universe, yes, right.
So when you're talking about that, that was a very, very uneducated kind of stupid conclusion that he made without having any facts.
Based on what he heard from somewhere.
Based on not only what he heard, but his summation of it.
Right.
Like somebody suggested one possibility in a realm of maybe 1,000 possibilities, and because they suggested that one possibility, that's all he heard.
Yes. So we are getting to the end part of this program today. This is such a critical point that seldom is talked about. We have seen many what is known as relationship abuse at the old age because of sexuality and sexual expectations and not having enough education and resources and knowledge about it. So sex is possible during old age. Sex is a part of life until we are dying, and then so it's best to know all about it so we can enjoy it. At this point, I'd like to invite you to please join us at 4 o'clock at the hour with another episode of Codependency, Trauma, Relationship, and Addictions with Dr. Robert Jaffe and myself. So thank you for listening to us, and we look forward to rejoin you in a short few minutes.
And remember, all you need is love.
And all you need is each other.
All you need is each other. Okay, hope to see you.